you so much for joining us on the another session of Beyond Boundary with Homeopathy 360. On another day, we are having another session with Dr. Ranjan Belsare from Nagpur. Dr. Ranjan is a distinguished homeopathic physician, educator, and the speaker with a remarkable academic and professional journey. He is graduated from TSHMC with flying colors, earned a gold medal from PGNAHI Nagpur, and completed his MD from NIH Kolkata, one of the most prestigious institute in homeopathy. With over a decade of clinical experience, Dr. Ranjan has established a highly successful and busy OPD practice where he treats a wide range of cases with precision and expertise. His patient-centric approach, combined with deep-rooted knowledge of homeopathy, has earned with him immense respect and trust. And we can see Dr. Ranjan on the regular basis. He teaches lots of students and practitioners with his clinical tips and his ideas, which he applied in his practice. We also saw him on his Instagram, on the social media platform, where we are very inspired from you, sir. And with over a decade of clinical experience, Dr. Ranjan has established a highly successful and busy OPD. His excellence in the field has been recognized with prestigious awards, including the Young Achievers Award and the Homeopathic Youth Icon title. These accolades reflect his dedication to advancing homeopathic medicines and his impact on the community. And another thing, beyond his clinical practice, Dr. Ranjan is an influent educator and speaker. He has delivered numerous seminars and webinars, mentoring aspiring homeopaths and sharing insights into advanced homeopathic treatments. His ability to break down complex topics into practical, actionable knowledge has made him a sought-after expert in the field. So we are very happy to have you, sir, as our respected speaker on this webinar series with Homeopathy 360. Thank you so much, sir, for giving us your precious time.
Thank you so much. Thank you so much for the lovely introduction.
Thank you so much, sir.
Can we start?
Yes, sir. And sir, before we start, I would like to ask you a question that you have chosen this topic, which is from text to practice, applying Boericke's Materia Medica effectively. So please, can you share your goal behind choosing this topic?
So my goal for choosing this topic is when I was in my BHMS years, I don't have any idea about what Materia Medica is.
Yes,
beside the textbook of Materia Medica, which we from the Dr. S.K. Dubey sir, which we solely use for the academic purpose.
Okay.
We never, it does contains many valuable pointers into the practice and other in other areas of homeopathy, but we solely use it for the academic purpose. And we only know we only know aconite for the fright, podophyllum for the brainia for the cough, and belladonna for the tonsils. Rather than that, if you have any other symptom, you will get confused. Okay.
Yes.
So yeah, when I was in BHMS, I was not intended to do homeopathy. Rather, I was more into the allopathy. I used to do shifts in ICU. I used to go to the general practitioners to learn how to practice allopathy. And yeah, I was not even interested in homeopathy, never believed in homeopathy in my life till my last, till the internship. Okay. So that's how my in whole my BHMS academic years, I will more into the allopathy, and my mind was become so much into the modern medicine that I cannot believe how that homeopathy works, or I even don't understand that how homeopathy can heal, like things like that. And I was thinking that homeopathy is not at all to be practiced if you want to get your bread and butter. Rather, you go for allopathy, at least you will have some butter. Yeah. So that was my story. story of each and every homeopath, many homeopaths who are still studying. And because I tell this story every time because I see many students like me.
Yes, sir.
And yeah, and when then some circumstances happen, and I was more, I fell in love with homeopathy. Then when I was in BHMS and I was doing my internship, and I was converted to homeopathy. I was I rather find the Mathematica very difficult to read, very difficult to memorize, because in allopathy we have one pharmacology book. If you know, uh, in our time we used to use Dr. K.D. Tripathi's pharmacology, the
Yes,
textbook
sir.
of
Yes,
pharmacology.
sir. Yes, sir.
Dr. K.D. Tripathi. That was our goal, to read that so that we can use our doses properly. What are the
Hmm.
indications? What are
हाँ
the
जी, sir.
contraindications? What are the side effects? What are the adverse effects? What are the toxic effects? And
Hmm.
when we should use this drug, like paracetamol is used in the fever, it is mild analgesic. Okay, and its dose is like this per kg, mg per kg. So you can give it is have reactions if you take with this drug, or if you
Yes, sir.
have side effects if you take it for a longer time. It has toxic effects if you take it in a very large doses.
Large
So
doses.
when
Yes,
I
sir.
came to the when I turned to homeopathy, I wondered where I will get this knowledge of Materia Medica, because I was more into the pharmacology.
Hmm.
So this was my problem, and this was the same problem was faced by many
Yes.
homeopaths many years
Uh-huh.
ago when they turned to
Huh.
homeopathy. Okay. The best book they used was Boericke
Yes.
Materia Medica, because there you will get the sphere of actions. Like in paracetamol, it acts on the parasympathetic nervous system, so that it can bring down the fever, like that. So my mind was more into that. And so for me, it is more easy to have my pharmacology book in homeopathy. I never call it a mathematical, the pharmacology book of homeopathy, where you can get each and every symptoms, where it can be given, what's its sphere of action, where it is should not be given, in which potency it should be given,
Yes, sir.
on what basis it should be given. Like all these things to me was then and there at Boericke Mathematica. So it was very easy to pick me up and to get in fall in love with that book. And that's why I chose, because when we turn to homeopathy, we are so much blank. Many of us have only heard Materia Medica.
Yes, sir.
We हमने सुना है, lycopodium is chilly, lycopodium is hot, and
Mm-hmm.
like that.
Really.
It has, but what are the actual indications? We
Yes,
have
sir.
two or three pages
It's
dedicated to
important to
lycopodium,
understand.
like this, and we don't know other indications. So what we do, then we try to
Sir.
fit the drug into the patient, rather than fit the patients to the our Materia Medica, where it should be belong to. So
Yes,
that's
sir. Of
how,
course.
yeah. So
And
that's
sir,
how, yeah,
that's why we see every homeopath. We see the Boericke Materia Medica on his table,
yeah.
right? So there's a, of course, there's a reason.
Yeah, this is the reason, because it is very easy to handle, and many homeopaths, or many practitioner, or the young practitioner who want to start their practice in homeopathy, they can easily connect to that text, and they can easily apply it in practice. For example, we when we go through today's session, we will understand
We will
how it is.
discuss. Yes, sir.
So
Sure.
that's why, but the motto is, okay, you have your own pharmacology of homeopathy.
Yes, sir.
Like
Totally.
allopaths, they know by heart, when I will give this drug, it will act on this. It has this action, this side effects, this side reaction, this is adverse reaction. So they are more prepared on it. Okay. So for me, it
Okay,
is
sir.
Medica. And that's why I
Oh,
choose, because it will be useful to the beginner, and it is still useful to the master, or those who have many years of practice. It is still stood the test of time, And that's my motto to choose this topic. And other thing, that's how I practice mostly on the Boericke
Okay,
method.
sir.
Yeah. So
Okay, sir.
this is the sole motto of my to choose this topic.
It's a very inspiring motto, and we have attendees, many attendees, and many homeopathic lovers want to hear you today, sir. So, sir, please start.
Okay, so I will share my presentation.
Yes, sir, sure.
Okay. So the topic, why this title, from text to practice?
Sir, can this presentation be in full screen?
Yeah. Uh, Start. Okay.
Yes, sir.
Yeah.
It's clear.
So why I choose, we all know Boericke Materia Medica. We all know that Boericke Materia Medica is very important. But how to uh, what can I say? How to turn that Materia Medica into the successful practice, or how to turn what can I say? Uh, how to decode that text to a prescription, a successful prescription. That's my motto. That's why I chose this title. That's from text to practice. How we can use that text in that Materia Medica to the real practice, and how we can see it in our patients, so that it can be applied very effectively for curing the patients. Okay. So we will start with a short biography of Dr. William Boericke. Dr. Boericke was born uh, in Austria. He has graduated from the Hahnemann College in Philadelphia, where then he moved to San Francisco, and uh, for that, and practiced as a homeopath for more than 50 years. Those who know, Dr. William Boericke has uh, 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 assisted Dr. Herring in his graduation, or in his learning day. If you read his Dr. Herring's biography by Dr. Calvin Nair, where there is a clear mention of Dr. William Boericke, where that he was very closely associated with the Dr. Herring. So we can already say that the people from Dr. Herring's, if you say Dr. Nair and other, they are very particular, and they are very genuine in their work. They might be if you see in Nair repertory, if you see the Herring addiction, which is compiled by Dr. Many volumes are compiled by Dr. Nair. They are very specific, they are very particular, and they are very accurate. And that's why, as a student of Dr. Herring, Dr. William Boericke is no other exception. And if you go through Boericke Materia Medica, you will already see that in how perfection it has written, and how much work has been put on in that work. And that's how we can use. That's how we will still rely on the that book which was written many years ago, and which is, uh, if you go through the first uh, introduction, the preface, it was the ninth edition. So in the lifetime of Dr. William Boericke, it was so popular that it was run into the ninth edition. We never see any old literature that has, in our homeopathy mostly, that has been run into that much of education, that much editions. So if you know how popular at that time the will the Materia Medica, the work was, so that it has run into the nine editions. Okay, nine editions was been exhausted until, and with each and every edition, there are more and more additions from the William Boericke. We can see either as a form of a polycrace, either it as a symptom, or as a small remedies. The Materia Medica grows larger and larger. That's why it is so important. Then he was a co-founder of Pacific Homeopathy Medical College and Handman Hospital. He published Homeopathic Materia Medica in 1901, and Dr. Oscar Boericke added Repertory it in 1906, because the work grew so larger that it should be associated with the repertory. Dr. Uh, William Boericke passed in 1929 with a massive heart attack. That's why this work give you so much uh, practical plus clinical exposure, and it is very easy to practice, and it is written, if you see that it is written so that it can be useful to the beginner and to the old or the master prescriber also. So it has very immense value in our classical literature. It is one of the most practiced, most read the work till date in homeopathy. If you are not have your hands on Boericke's Materia Medica, if you are not reading it regularly, please do, because this soul book can change your practice and change your life from upside down. Okay, so uh, in ninth edition, Dr. William Boericke has written the clear structure how he has wrote this book. Whenever you read any book, please go through the preface. In the preface of ninth edition, it is clearly written how this book is written. Okay, so we will see in the perspective of preface with the examples from the Materia Medica that it is how its structure is. Okay. So first part is Materia Medica. We are not getting into the repertory. We are only talking about the Materia Medica. Okay. So the Materia Medica part, where Dr. William Boericke writes in his preface that this book contains the well-known, please read again, well-known verified characteristic symptoms of our medicine besides other less important symptoms. Other less important symptoms. This is more important. We all know pulsatilize thirstless, pulsatilize ambithermal, maybe, pulsatilize weeping, pulsatilize changeable. But after, beside that, what are the other more important symptoms where you can locate pulsatilla when you are not sure that this picture is to be rely upon? Because weeping, changeable, uh, uh, ambithermal, there are many remedies. If you put 3 rubrics in your repertoire chart, you will see many suggestions from the from the repertory. But what are the other less important symptoms which will aid for the selection of the curative remedy? He said curative remedy. Okay. And that's why in Boericke's Materia Medica, there are many symptoms which are underlined, which are in italics, and you will never see any these symptoms in other Materia Medicas. Okay, like of pulsatilla, that 2 or 3 normal stools per day. It is written in italics. It is never written in any other Materia Medica that the patient has 2 or 3 stools per day in pulsatilla. If you want to confirm that my patient is pulsatilla, ask about her stool, that how many times you go for the closet. And if you say, sir, I will go for 2 or 3 times and I had normal passes of stool, I never get satisfied with one time, then you can confirm, or it will aid you to the selection of to the pulsatilla. Again, he said that all the new medicines and essential the published clinical experience of the school has been added. So the experiences at that time, there are many schools, not not the not this type of in this compared. I am not talking about this contemporary schools which we see today. But if you have this any experience, that time was also some homeopaths who have believed in pathology more. There were some homeopaths who will believe in low doses, some were believing in mentals, some were believing in the Hahnemannian approach, the proving symptoms. So he had collected all of their experiences, which were verified and which were very important, and it has been added in the Materia Medica. So you don't have to go uh, around, and you don't have to look from many books. He had added all this experience of this school in the same book in its present compact form it contains, and which is very true that in its present compact form it still contains, I will say still contains, the maximum number of reliable Materia Medica facts in the minimum space. What Dr. Uh, Boericke has done, he has collected many useful and verified symptoms, and he has packed them in a most in the minimum space, but they are the most reliable facts. That's why Boric Mathematics is so important, because each and every symptom, each and every line is thoroughly been checked, verified, and after that it has added in that text. So not any line is useless. Not any line is we can say is not important. Each and every line of this work is important. If you want to success, just go through it, and you will see the magic of the Boric Materia Medica. How wonderfully it acts in each and in condition, and how wonderfully we can get uh, indications for each and every condition. Okay, so that's how it has been written, it has been structured. So uh, as we see, the Materia Medica part is start from the general paragraph. In that first paragraph, before the particular uh, of indication starts by the anatomical way, there is a general paragraph which is more important, because here Dr. Borik mentioned the spear of action, like it has acts beautifully on the respiratory tract. It has more mark action on the gastrointestinal tract. So you can relate, and then you can go deeper into the remedy with this thought that yes, this is when this condition will appear, I can use this remedy because it has this more action on that particular organ. Some pathological actions, like in Viscam album, he has written that it lowers the arterial blood pressure. In his pathological, it is in material doses that it has lowers the blood pressure. That's why if we give Viscam amalgam in the lower potencies or in the tincture form, it helps to reduce the higher blood pressure. Okay, so that's how he has given clues for the medicine, not only as a proving medicine, as a proving symptoms, but it has also given his pathological action. So you can use it in the both ways. Okay. Then there are many generalities. If you go through this first paragraph, like in pulsatilla, it has written VP, chili, and thustless. In chamomilla, it is written hot, cross, and irritable, like this. So the general uh, axis, if you can say, of this, of many remedies are written there, so that you can think that yes, if I want to give natrium, it should be hot. It should take cold easily. When we see that we will label natrium as hot, but Dr. Boericke has written that it catches cold easily. So many of our myths, many of our what we can say herd Materia Medicas will going to shatter after we read this, that the the best general picture which is given by William Boericke is the true and the only rare only picture of our that drug. Okay, so the generalities are also given so that you can go, and then when you will in the differentiation of one or two remedies, these generals will only play role in the selection of remedies. Okay, so these things are given in the first paragraph. Then it will start with uh, the particulars of the then the particular parts and their indications has been given, and in that many diagnoses has given, like anemia, like Hirschsprung disease, like chronic scleritis, etc., etc., etc. Why he has given that, and he said that in the preface. Okay, why he has included this diagnosis. If you see in many texts that diagnosis is not important, patient is important, then why Dr. Boericke has introduced diagnosis, many diagnosis symptom, or many the disease diagnosis or diseases he has mentioned in his Materia Medica. I I had choose I was choosing other term for this, but uh, I can relate to this term diagnosis more, because okay, when we see and when we talk that, we will not say the disease diagnosis, we will say only diagnosis. And we'll say that no, diagnosis is not important in homeopathy. You will go and you just take the case and just give the medicine. And this is not true. And why he has the disease diagnosis is important. He tells in his preface that he said that he used the disease designation not for the purpose of recommending the particular remedy for that disease. He had never intended to do that this particular remedy will cure this disease and this particular remedy will cure this disease. No, but to show the great variety of remedies that may be used for any form of disease otherwise indicated. That if you go through that remedy and if you go through that diagnosis, the disease picture, if you get that disease picture, if it fits in other disease also, or these indications will fit in other disease also, that you can also give. So it will expand your area of diagnosis or differentiation. That's why he has included so many disease diagnoses in this. Okay, are you getting me? Okay, so for the same, he continues that for the same reason, I have included nosological terms, that is the diagnostic terms in the symptomology and therapeutic index, as this is a practical handbook for everyday service. What is Boericke Mathematica? It is a handbook for practical handbook for everyday service. This is not the book which we will you read once in a lifetime. No, you have to read it every day, because it is useful in everyday practice, and any aid for finding the curative remedy ought to be utilized, so that you can find the curative remedy by anyhow. Many times what happened that we get the diagnosis and the patient will give the general symptoms and we are blank. Okay, for example, we have rheumatism and that, and we have osteoarthritis. Osteoarthritis term, for osteoarthritis, we have n number of drugs. Okay, sorry. So we have n number of drugs, but how this diagnosis will help us? Dr. Boericke has given some it in some drugs, and he had given it but with offers his particular symptoms, and that's how you can use it in your practice. For example, uh, we will see the in the next slide. So that's how it is important, that you will, if any disease come, if any disease diagnosis came, you can just remember that, yeah, these 2 3 remedies are given in Boericke, and let's see what other other indications of what other indications we get from the patient, and let uh, uh, differentiate these 3 4 drugs. So that's how it is very important. If you go into the repertory chapter, that's how they have prepared the index of that therapeutic index of the whole Materia Medica. Okay, so that's why it is so much important. Next, now we will see some uh, examples of how diagnosis will help us in the choosing right remedy. Nowadays, we had also heard the epidemic of GBS syndrome, the Guillain-Barré syndrome in the some areas of Pune. Okay, so we all know it causes the ascending paralysis. Okay, but if you go through Boericke Materia Medica, there is one another drug. It is called as, it resembles, it also produces the same condition, and in this it is written that resembles acute ascending paralysis of Landry. Wells give this uh, reference in this book. So it resembles the acute ascending paralysis of Landry. Ascending paralysis of Landry is none other than the Guillain-Barré syndrome. And if you go through Vipera, it is given in the first paragraph that it produces the condition which resembles the acute ascending paralysis of Landry. Then we have many times we will see some cases, and we will see that uh, the allopath say that it is not curable. But we never, and when they refer to us, we will also say, oh, it is the incurable disease. It is written everywhere that it is incurable. We cannot do anything. Maybe we cannot cure that patient. Maybe we can help that condition. Maybe we can help that patient in improving his lifestyle, improving in his willpower. We can reduce their symptom. So many times these diseases came and they are only with the diagnosis, only diagnosis. The symptoms are never written in any Materia Medica. Then we will find for this is then we consider it as a one-sided disease, and this is not curable. How we can cure that when there is no symptom? But if you see in Boericke, many diagnosis, many disease diagnosis are written so that you can use, at least you can try to match the picture. Ke bhai, does this patient have this this remedy? So one of the diseases is Duchenne's muscular dystrophy, where you get the pseudo hypertrophy of muscular part, where fats are deposited. So it is in Boericke Materia Medica. At that time, it has given that muscular pseudo hypertrophy, that it is useful in, I don't know, curative or no, any palliative, but it has written that muscular pseudo hypertrophy, that it can be used in the conditions of muscular pseudo hypertrophy. And in phosphorus, it is written. If you mind well, that it is written in pseudo hyper in phosphorus. That's why many times calcarea phos, acid phos, this type of remedies are very useful in, and they came if you go through that, the patient many times matches to this type of these 2 3 remedies. Okay, then it is clearly in hypothyroidism. Only one word, hypothyroidism. If you go through Kalika, last line, it is written hypothyroidism and Coccitis, inflammation of coccyx. Coccitis, it is written. So simple. Okay. Can you mute, please? Yeah. So it is written that if you don't know anything, you have a case of hyperthyroidism, just you can think, oh, yeah, Kalika has it. Let me see what other remedies also have this symptom. Coccitis in the coccyx. Okay. Then multiple sclerosis. He had given medicine for multiple sclerosis also, which is otherwise considered as uh, curable. He has also given posterior spinal sclerosis. Hello, can you please mute
Yes, sir. Yes, sir. We
those?
are doing. Okay.
Okay, so it is given symptoms of multiple sclerosis, and it is given in plumber. So if we have that diagnosis and it is written in our homeopathic book that it helps with this condition, then you have some confidence for accepting the case. Now, it is written in my book. Yes, that can be, that can certainly be treated. I don't know curatively or palliatively, but yes, certainly it can be treated, and it will give you the confidence to the handling in the patient that yes, I have some medicine which can also cure, have benefited this condition. Multiple sclerosis, posterior spinal sclerosis. Patient cannot move, mostly paralytic. There you can also use this remedy, and it is given in plumber. Another is recurrent episcleritis, chronic scleritis. In one day, in when I was in NIH, I heard a story from my colleague, which was from organic department. He said that once a homeopathic doctor has suffered from this episcleritis, and he has done everything which was possible at that time, and he was not getting any relief. And somehow he has then went to Boericke Materia Medica or like that, or someone prescribed him, and he took that remedy, and his scleritis was gone, and he was been palliated. And after some days, he had that same what can I say, same episode, and he was in abroad, and he was admitted, and he was given many medicine. He was not getting any relief with the symptom. He ran out of the hospital. He searched Thuja, because it is given in Thuja, recurring episcleritis, chronic scleritis, it is given in Thuja. He searched Thuja, where is Thuja, where is Thuja? He got it, he took it, and he was better in no time, 1 or 2 days. So that's how miraculous. Nothing. I am not promoting that you should give every episcleritis patient Thuja, but yet at least you can think of now that yes, for scleritis, I have at least Thuja in my mind or other remedies also. So that's how simple Dr. Boericke has made for the, at least for the beginners, those who are came into the practice 1 or 2 months or one first year, and they don't know how when to prescribe for this type of condition, and they suddenly get some big diagnosis, and they'll say, oh no, I don't know what medicines, and I don't know what remedies I should give him, give to him, or maybe I can help her. I don't know, does our medicine have this potential to cure this disease also? Just go through Boericke. You will see many such disease diagnosis, and you will be confirmed that yes, my medicine, my Materia Medica has so much references that we can many diseases like that, which we call as incurable, maybe, or that cannot be done in any other. At least I can give some results in this. Okay, so that's why it is very important to uh, go through each and every word of Boericke, because many times if you miss this, you will not able to collect it in when the patient came to you. Next, many laboratory findings are also given in these remedies. Okay. So when you go to the blood report, it or the urine report, it has also given in this. So by only seeing the report, you can prescribe. Okay. So for example, I have a case. This was a case of recent. That's why I'm telling you. It was a girl of 3 years of age, and she was suffering from uh, the massive urinary tract infection. There were pus cells, there were bacilli present, there were traces of protein, many protein, and the patient was not having any relief with the allopathic medicines. He also said that sometimes clots were also passing. In our Boericke Materia Medica, it is written in some remedy that urine contains blood also, urine contains pus also, urine contains mucus, that is protein as substance or maintain, and it is also contains the clots, that is epithelial cells or like that. And the patient is not here. Patient is some girl was in her home. They cannot bring it here because she has so much pain. She was crying and crying and crying. So, I gave a remedy on this line only, and seeing the report. And after this is on 8th day, and after 10 days, the patient was getting better. And after 10 days, the whole picture was normal. The patient was, and the remedy which we gave was uva ursi. If you go through the first paragraph of or in the urine chapter, you will see that in uva ursi it is written that the the urine contains blood, pus, must have the mucus, clots. It is burning like anything. And if you only have the report and you have seen all these things in here ticked, कि भाई ये भी है, this is all, this also. You can give you uva ursi. You will get 100% benefit in this type of cases. Again, there is written in another meditation in septic states. I will not. I will show you a case. It is written there septic states, nothing more than a septic states. Sepsis has been done. So I had a case where a patient who has developed an abscess and mass after the the prostate has been removed. Okay, because it has the PSA was very high, and the doctor suggested that you should remove your prostate. And after some time, he has developed the in that region abscess or mass, anything they don't know, that we had done the USG, and this has been found. CT abdomen also not helping that patient, and the patient was suffering from 103, 104 fever, spike of fevers. He has taken so many antibiotics, so many IV antibiotics, oral supplements, oral other anti-inflammatories, but the fever was not going down. When he visited me, he told that, sir, I was taking since it is so in 10 days, but still the 10 or 15 days, he told me that that still the fever is there, and I'm not getting, my fever is not going down. Please help me. So only septic state, in the same remedy, we will say septic fevers. Septic fever, that is due to of any abscess or lesion or any sepsis. And the drug we have is pyrogen. We started him on pyrogen. We just took his pulse. He said, sir, I just took a heavy dose of antibiotic, and I just took one antipyretic in a big in a full dose. Still, I am having 101 fever. And when we had his pulse was 130, 140 like that. And we instantly started pyrogen, and within 7 days, within third day, he had only one spike, and within 7 days, the whole fever has gone. He was energetic, nothing. And then we told him, please, sir, can you do again another USG? And after some time, and the next USG said that it has revealed no significant, nothing is there. Prostate is not visualized because it has operated, and the patient was settled, which is not getting better with allopathic medicine. So this is how we can treat our patient, but by just seeing the reports. I had no time for to take his history because he was in so much agony. He was suffering and he was very weak. I just saw the report, took the pulse, because I had in mind that this is a septic state. This is a septic. This is a fever is also the sepsis. This is a septic fever, and I know the medicine which is work on this condition. It is pyrogen. So, and the pyrogen did the magic. Next, uh, rare drugs. He also mentions that the new medicines which are not proved till date should be given because it can give it a then it can give them chance in our practice so that they can be further proved or the more indications can be added by practice. Many of our medicines are polycrest because they are used uh, repeatedly in the clinics and the clinical observations are added. And that's how we will see this long pictures, the broad pictures of our polycrest remedy because they have been used so many times and they had got so many conditions, and that's how the medicines or the indications has been added uh, successively in the upcoming days, and we will see the full pictures of many remedies now. So there are many remedies. I will just mention few because we don't have time. I'll just only few that when I was I was very struggling in managing the acute pains of rheumatoid arthritis, where the patient came with me, and I was thinking I used to use this remedy and the patient was not getting better and he was turned to allopathy. Sometimes they will stay with us. Sometimes they will leave the treatment because that if you're not able to handle the acute state, how can you handle me in the chronic? So that's how we the patients are in rural areas. So then I found one very instructive remedy, propylamine, where in Boericke has written that it is very much close to bryonia, but it has restlessness and it has fever like that, and the patient cannot lift anything, and that type of acute condition it has, and it has helped me immensely in my practice. In when I used to fail in many cases in managing acute rheumatoid arthritis, now we can successfully treat many patients with propylamine, and the patient very happy, and they will respond in 1 or 2 days. The fever will go on, the pain will go on, and again we then after that we resume our chronic treatment, and then it gives you and the patient also confidence in the doctor, so that the yes, if anything happens, my doctor is there. He can he can tell me he can manage my pains with the remedies. Okay. So another is Spingurus. I had a very funny incidents with this remedy. One day, one guy came to my OPD, who was in his 50s like that, and he used to be uh, a watchman at in the farms. We have they don't know. Sometimes they are not very well educated. They only uh, they don't know how to write. Don't know how to read, and they work. They live in this in any farm, and they earn their bread and butter. They don't know how homeopathy is and what symptom they have to give. He came, and I said, first I was absolutely how these patients are came. Then he said that you want myself, you want doctor, this doctor. He said yes. Someone told me that you go to this doctor. Well, what condition? What problem you have? He said I don't have hairs in this area. My hairs are getting uh, vanished. I have these patches of no hairs in my beard. Well, okay, okay. Again, next. That's all. Okay, then how's then I went made forward. What diseases we have in past? Nothing. Did any diseases have in your family, runs in your family? So nothing. Just please give me medicine. I have this also. I don't have time for this. Why are you asking so many symptoms? And I was right. If you don't have uh, uh, if he has only taken allopathy all his life, and now he came to me and he tell that what rubbish doctor is asking to me, why are he giving so much, why are he asking so many symptoms, so many questions, just give me the medicines. And I was very much in trouble. Okay, what should I give you? Then I know, then someday back I had this remedy for another condition. And in this Pinguris, you written that patchy baldness of the beard, falling off hairs from the beard. If you go through the this remedy, and I had given only this is written, and he has only this problem, alopecia of from the beard. So we gave that man Spingurus, and within nothing, he had not told me nothing, no desire, no aversion, nothing, 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 no maintenance. I gave him Spingurus, and within 2 or 3 months, all his patches were gone. All his uh, hairs were back. And that time, I felt often I fell in love with this text again, because if if that line has never been there, that book, I cannot cure this type of patient just with this line. So those who say that it is very difficult to practice in rare rural areas, in these areas, in this, if you have proper understanding of Materia Medica for the proper patient, you will never fail in any area. Okay. So then the modalities are also given. Then there are particulars you can also know. Then there are modalities also given, that better by cold water, coffee, worse afternoon, like that, aggravated by sunlight. Okay. On this, you can prescribe for the patient. Okay. I had this case of photodermatitis or the atopic dermatitis. The patient had so much severe uh, rashes on his body, which was getting aggravated when he goes into the sunlight, and he had only get better. He has so much itching. If you see the eruptions on forehead, on right side of below eyes, in on the both the arms, and it is aggravated by dust and going into the sunlight. We have this modality from sunlight, from scratching, and better by patient was better by uh, with the uh, sorry by cold water. Now patient has desire for pickles and sour. Now we can say, why not anti-crude? Anti-crude also get aggravated by sunlight. It is also had this type of eczema, itching. But the anti-crude patient is better by what? And the patient is also chilly. Anti-crude has hot. So we are not getting any particular picture. So, but we had this modality that cold water ameliorates and sunlight aggravates. We had given her fagoparum. If you go through fagoparum, this is a modality of fagoparum. And we gave it in the water doses in 30 potency only. And you can see we have never changed the potency, never changed the medicine. And after at least 5 or 6 months, all the eruptions from the body had gone. There are merely a mark. Okay. Now, so that's how it can, uh, it is very important to grab onto the modalities. And uh, rather being only theoretical, we can get many such important symptoms where we can prescribe only on modalities also. Or sometimes we have uh, a medicine which is not been easily uh, well uh, been presented by the patient. The symptom was not presented very thoroughly by the patient, but the modalities are very clear. So we can prescribe on that, and then we will see that the medicine is working very beautifully, like in this case. And sometimes we have uh, a broad picture of modalities that lycopodium is a hot patient, and he has desire for warm, and all his complaints are better by warm. But if you go through Boericke, it is written that hives or the urticaria is aggravated by warm. So if you are giving, if you see a patient of who's having urticaria and who has given you the symptom of lycopodium, like just lycopodium desire sweet, warm like this, and you think yes, yes, and the it's also better by warm. Please think again. So that's how the concepts are being cleared when you go through the Boericke for the particular small details. It has given that hives are better by warm. When you get a lycopodium picture, but the and the hives with hives, and the hives are better by aggravated by warm, lycopodium is the remedy. And that's why many times we see that are the patient was whole lycopodium. I have matched each and everything. Desire was there, his are there, but and he's also are there. Still, the medicine was not acting because it's not acting because we don't pay the attention to the proper modalities. Okay. So next, there are many concomitant symptoms are also given. For example, violent itching, fissure eruptions, acne, chronic eczema associated with urinary, gastric, and hepatic disorders, and it bleed easily. Okay, so we had a case of this chronic fissures and eczematous fissures, which were very bleeding, which are very painful. The patient was having pain in right knee. He's also had history of allergic rhinitis. He has too much homeopathic medicine for gastric troubles, and he's maybe he has some digestive issues, and he has desire for sweet and warm. We have given him lycopodium 200 first dose. Then he had some this pain in his abdomen, and he went to the USG, and he had uh, renal calculis. Then we shifted him on the LM potency. So we have fissures, we have calculi, we have gastric symptoms. Now, after giving lycopodium in LM potency, after a few days, all his eczema were gone. No other remedy was given. If you see, no other remedies were given. Berberis has given sometimes to relieve the pain, that too in many times in the 200 potency, and sometimes in the tincture, if because he was coming from the far distance. So that's how that's how simply we can diagnose the patient. And he was suffering from since 2 years, going to many homeopaths and going to many Ayurvedic doctors, but he was not getting better. And with this simple line that he has urinary complaint, that is, he has calculi, he has gastric symptoms, plus this fissured and which was this thing, and this is chronic eczema-like symptoms. Next example, if you want to give that, when we have used this medicine in many times after chikungunya and after many inflammatory fever conditions, that it combines the rheumatic, bronchial, and urticarial symptoms. The chest seems thin and go and to give away. We have heard bronchial and urticaria. We have heard rheumatism and urticaria. We have heard rheumatism and urticaria. But when the three symptoms are there, patient also have rheumatism, patient also have asthma, patient also have these allergies, and you are not able to find any constitutional remedy. Oh, what? Oh my God, is sulfur is also there, natrum sulfur is also there, urticaria is also there, rust is also there, and I'm not getting uh, proper picture. That time, these concomitants is also very important to prescribe. If you go through Pinus sylvestris, the last line of the paragraph, you will see that this line is written, and many times it will cure the patients which were not getting better with any prescription. Okay, these so many symptoms I'm not getting, but generalize it to a one diagnosis or one pathology, then see it that yes, pathology plus pathology is also a characteristic symptom. So we can see in Pinus, we can see in Lycopodium also. And that's the beauty of Boric. It has given many such symptoms. Just by adding one or two, 1+1, you can give the medicine. Yes. Eczema, urinary symptom, you also have gases. Okay. So simple, so simple. Next, now what he had given now, he tells about dosage and potency, because he had mentioned many in many in many drugs. He had mentioned the potency also, which potency is very suitable for that drug, or the this potency of this medicine is suitable for this condition. Okay, we will see the example also, but he has said that the dosage needs some apology. Why? Because there are some homeopathic and non-homeopathic doses are also given in there. It is of course suggestive of more often to be wholly disregarded. Okay, but okay, don't disregard it. Actually, it is only of suggestive. If you get the results in other potency, you are welcome. I have followed the lines of the earlier homeopaths in this regards, and given what has then considered the usual range of potency, to which I have added my own experience and that of many observing physicians. So the potency which are mentioned by Dr. Boericke are not just by कि भाई ऐसे ही नहीं डाल दिया कि भाई just go and then yeah this is give 30 potency only. He had taken the experience of many homeopaths, many observations, and after that he has given that they know this potency in this condition of this remedy is very effective, and that's why it is more important. Why? For whom every teacher of Materia Medica is constantly importuned by students to suggest the potency something to start with at least. That many times when a teacher teaches the Materia Medica, the student listens and they tells, sir, which potency? Sir, which potency? Sir, which potency? And sometimes teachers will also know because he had used this drug from lower potency to higher potency according to the patient. But when the student inquires, how I start? Should I give 10 sir? Should I give 6? Should I give 200? For to to give that discussion a pause, to discussion a end, Dr. Boericke had given many times the potency and the suitable doses of the medicines also. That's why it is the most important book for the beginners. For example, it is written in a remedy the sleeplessness with restlessness and tossing about. Use 30th potency. When a patient was suffering from insomnia, sleeplessness, he was restless in his sleep. He only tossed here and there. Doctor, I only turn in the bed. I was so restless. I sleep on abdomen. I walk. Then again I want to sleep. Still I don't get any sleep. And Dr. Boericke suggested that use this medicine in 30th potency. If you go through aconite, it is written there. Okay. Then after effects of keratitis, ulcus cornea, clearing the opacity, use 30th potency for months. At that time, there was not a suitable operations for cataract and other uh, eye conditions. So we have medicines for that also. So if you want, if you have a case of immature cataract, at least immature cataract, mature cataract needs surgery, no doubt. But if you had a case of immature cataract, it has not gone to that level, one of the suggestion is silica, but you have to use it very cautiously, because if you give it, it has then another effects. So it is when they use 30th potency for months, use it for 2 months, 3 months on a repeated basis. 30 dose, 1 dose, weekly dose, twice a day, like this. So it is written that don't give 1 dose. He has also uh, told that where should we give 1 dose. It is given in lachesis, that in if you do doses section, if well indicated, a single dose should be allowed to exhaust its action. You can see the contrast, and this is because it is of practical and clinical observation. From the clinical observations, in lachesis, he should read that a single dose should be allowed to exhaust its action. It should be given in 6 to 200 potency, and the single dose should allowed to exhaust its action. So for the beginners, it is very important that you go through the Boericke, you will solve your half of your potency problems. Okay. Next, the relationships are also given. That the particular relationships are also given. Like if we have a patient of lycopodium, and if we are giving lycopodium for the indigestion, and the patient is better, now he has better, but it is not getting totally better. The Boericke writes that hydrosis follows lycopodium in indigestion, not other condition, indigestion. Many times we have given lycopodium, and sir, I have better, but it is not getting totally. I am not totally better. I am 80% better. I am 90% better, but still I have some this. I don't pass stool regularly. I have hard stool. In that condition, Hydra still will help. So that was also been solved by Dr. Boericke. When you see that, sir, ab kya karna? Sir, now what I do? I have taken the case, lycopodium was the medicine, and he told patient are better, but now the patient is not getting any progress. Hydrostis, and you see in relationships that hydrostis not really it is merely mentioned. Now we are giving carbovage, you are giving this medicine. In fact, it is written also in, if you go through S.K. Dubey's textbook of Materia Medica, that a dose of carbovage every weekly will enhance the action of lycopodium. It is written in lycopodium in S.K. Dubey's Materia Medica, S.K. Dubey says Materia Medica. But here only in indigestion, which is the in which lycopodium is more frequently indicated. If it stops working, it is not getting any more, you can give hydrostis. Again, Crotalus cascavella often complete the curative work of lachesis. Curative means patient still giving the symptoms of lachesis, but with the various potencies of lachesis, the patient is not getting better, and the patient is not throwing any other symptoms. So that you can use any other remedy that lycopodium follows with lachesis. But the patient does not giving any other symptoms of other medicines. It has still the the lachesis symptoms, and but patient is not improving more further with any potencies of lachesis. In this case, Crotalus cascavilla often completes its cures. So that's how the finer differentiation is also done in the Boericke Materia Medica, where you can not you we only get the big picture. That's why I said that we only heard कि भाई lycopodium के बाद carbovate दे दो, give carbovate after lycopodium or other things, and then that's why then we will go in the circle and circle after one good prescriptions, because we don't follow the proper guidelines in the books in the relationship parts, in Boericke also, in Alan Kin also, and anywhere also. So that's why, in conclusion, I have never. I have took all these points from his preface. That's how that much important the preface of Boericke Mathematica is, and this the conclusion which I'm saying is also is mentioned in the preface, that the fact is we need any and every way of finding the right method, this to find the simple simile, the simple symptomatic symptom, and the reach of all the pathologic simillimum, and I maintain that we are still well within the line of homeopathy, that is expansive, progressive, science foster and science fostering. That we need each and every way. We need pathological, we need mental, we need toxicological source. We need each and everything so that we can reach to that simple symptomatic simillimum by being in the line of homeopathy, not going prescribing many remedies, not going for uh, what we can say uh, combinations, not going for uh, polypharmacy, not going for patents, just for this simple symptomatic simillimum. And Dr. Burnett has quoted this. Dr. Burnett, whom we abuse of using polypharmacy and like that, but he has given this thesis that if we are within the line of homeopathy, if we are within the line of within the principles of homeopathy, we want every way to reach the simple symptom similar, because homeopathy is expansive, progressive, science fostered and science fostering. It is homeopathy is nothing but the science which is giving many patients, many person their life back. They are going to their works because of this. They are happy with this, and they are the homeopathy has put a smile on their face. This is only because homeopathy is science. Nothing, nothing but that. Art pass comes later. Okay, so that was all from me. Thank you so much for the patient listening. And if you have any queries, please ask me. Thank you. Over to you, ma'am.
Yes, sir. So anybody, if have any questions, please ask your questions. And today we explore the rare drugs, and we see the importance of relationships of the drugs written in Boericke, Allen, and every book. It is very important to understand the relationship as well along with the drugs. So, sir, we have questions now. Like Vasant
Yes,
Kumar has asked how to give LM potency, like preparation and dosage part.
it is given in the organon that you should take 100 ml of bottle should be divided in 8, 6 or 16 doses. Put a rectified spirit, put one globule of LM potency, give 10 stroke, put that one 1 cup in 1 tumbler of or 1 teaspoon of solution in 1 cup. Stir it 10 times and give. Take a 1 spoon or once a day, twice a day, like this. This is nothing other. Uh, uh, we don't use in other way. This is the classical way to use it. And if you want more readings, it is given in organon. It is also, if you want further readings, Dr. R.P. Patel has a very good book that My Experience with 50 Millisecond Potency. You can read through that. But the basic and the most reliable source is organon. You can read from it. It is very clearly mentioned. There are the guidelines are very clearly mentioned.
Okay, thank you so much, sir. And next question we have from Dr. Vikas Kumar that, sir, Yuva Ursi dosage, sir, Q form or potency form?
If the picture is that much clear, now I use 6 or 30 potency mostly, and they are giving me much more result than the mother tincture.
Okay. Next we have question from Pariniti Srivastava that enuresis medicine in your slide.
Acha, you find it is there in the Boericke Materia Medica. For enuresis, if you see go through calcarea carb, it is written that enuresis, the calcarea should be used in 30th potency, and as intercurrent, or if the medicine is tuberculum, it should be given in 1 m potency. So it is enuresis calcarea carb 30 or tuberculum 1 m.
All right. Next we have Subhajit Mahato has asked medicine for alopecia of beard. So it's a very direct
That's
question.
spingurus, which we have. Patchy beard or the alopecia of beard is spingurus.
Pingulus. Okay, right, sir. Next, Seneca Bora has asked how to reach up to that. What is important in drug? Like you told, peanut recipe plus GIT plus skin.
Okay. First of all, we are if you know your Metramedic or your Boericke correctly, will
Hmm.
you will find the ways to patient to extract it. Okay. So the basic mistake we done that we uh, more indulge into the recording of symptom rather than analyzing and observing it in the patient. So that if the patient comes, what happening? Yes, 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 yes. We hardly look to the patients. We hardly
Yeah.
look to we give any analysis to the patient of how he is talking and what areas he has mentioning. So if you focus on that, if you go with the flow of the patient, you take the case and after that leave that case paper behind and study it properly, then look at the patient and see what you are getting from this case recording and what your observations you are getting. You will see many symptoms of this, and then analyze it that yes, the patient has in the complaints of bronchial in his chest also, he has skin symptoms also like that, and this all has combined, and then I'm not getting symptom, let me find this remedy which has combined these pathologies. So then you will oh no, that I know one remedy that's which combine these three symptoms or these three systems. Okay, that's how you can you will going to get it. Like in pulsatilla, that's to, at morning I had a yellow stool, and now I had some watery stools, and in between I had passed some soft stool again. I have, this is the changeability. If you put all the things that stool soft, stool yellow, stool watery, you will not going to get pulsatilla. You may get pulsatilla, but rather in uh, if you will not think that this is the changeability of pulsatilla. If you see to the patient is sometimes the patient is weepy, or how he is conveying the message. This is also important. So the observation part is also important. But that's how what Boericke teaches, that you don't have to be a case recorder. You are a homeopath. You should see, observe, took the notes of important and leave it the rest. Give the rest.
Yes, right. And even from the beginning, we are told that observation is the real key for any good prescription.
And what to observe? This is also written in Boericke Mathematics. If you see a patient who has constipation, tell that patient, just show me your abdomen. If the abdomen is retracted, inverted saucer line, thumbum, the
Yes, sir.
patient, it is inverted, it is calculated for silica line.
Yes, sir. It's a,
Everything is there.
we just need to observe clearly.
Yeah. Then we have to look to the patient. We have to connect with the patient. We
Yes,
don't
sir.
rather than coloring the papers, we have to look the patient. Why he has coming? What that patient is? How what build he has? What what type of symptom? How he has narrating his symptoms? Is he fast? The doctors have I have this. This is also the Merksol, Hypersol, talks hastily. So
Yes,
simple.
sir.
If you record, अरे थोड़ा धीरे बोलिए मेरे को लिखना है, you will miss
Uh-huh.
the Merksol.
Jeez.
हाँ,
Such
what we
patients.
do? अरे अरे सर, अरे थोड़ा थोड़ा धीरे बोलिए, थोड़ा हमको लिखना है पूरा, मेरे को वो सॉफ्टवेयर में टाइप करना है, मेरे को वो ये भी करना है, थोड़ा धीरे धीरे, हाँ एक एक करके बताइए. हाँ, आई हैव दिस. You have must miss the Merksol.
Yes, sir. We see such patients.
Yes.
Okay, so next question we have from Arpana. She is saying, "Hello, Dr. Ranjan. I know potency selection is very individualistic, but in neuralgias, 1M works better and pathological cases 6C. So, any guidelines for potency selection based on disease?"
No, I don't see any potency differentiation, but if we have, there is a concept in recent days we have discussed this in other in Instagram platform also, that there is a concept of jars concentric circles.
Okay, okay.
So what jar used to told that with potentization, the power of medicine is not increased, that we have to raise the power. No, his
Okay,
area of penetration increases. Are you getting?
okay.
Okay. So we are giving tannin, then it is of higher power. No, if you see the material is so less in that medicine, but due to potentization and dynamization, it 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 its penetration, its depth is increased. For
Okay,
example, if you have a diarrhea patient whose stools are smelly, recurrent, and sometimes yellow, sometimes we give portophylum 6 or 30, because that's the plane it is having. When the patient has 10 or 20 stools and the patient is more dull, we give 200.
hmm.
If the patient is more uh, severe, we give one impotency, because the disease is penetrating from the organ to the sensorium, now to the vital force. It is very more depleting. So we need a higher potency. Or just like many medicines, we have general symptoms, we give 6 potency. We have general plus physical generals, we give middle potencies. We have generals plus physicals plus some mentals, we give from 1M to 10M. And when we have generals, physicals, mentals, and the characteristic symptom, we can give a higher potency. So if you want to reach to the mind, we have, if you do this, need more penetration to that case, we will need the more
More.
higher potency.
All right, sir. All right.
Okay.
So next we have Parinita. She's asking, please share your experience in xanthelasma.
Xanthelasma is very difficult to treat. We have to check the lipid profile. If it is better, we have to correct it, and then according to the patients, sometimes we have to give the remedy which is more suitable, which has these arteriosclerotic conditions, or if the patient is not having this uh, abnormal lipid profile, so you have to take it as a local symptom or it has a constitutional symptom. Then the many ways to indicate that, if it is a bilateral, then you can take bilaterally symmetrical thyroidinum, syphilinum, arnica like remedies. If it is only on the right side, you can see the right side medicine. If it is not very tedious, then you can use some anti miasmatic medicines. So that's how we are taking treating the xantholacemus. So these are the step by step. First, lipid profile, it is normal. Then, if it is not normal, then give the medicine. Then see, and that's how we can proceed with the xantholacemus cases.
Okay, sir. Next, we have Mona Kumari. She's asking about a real short, quick case. She's asking, sir, if patient is suffering from breathing difficulties, asthma plus rheumatic problem, knee pain, history of filaria, family history of asthma.
So what are the other symptoms? Okay, rheumatism plus asthma, we have verbascum also, iscum album also, acid veins also. Okay, same combination we get in natrum sulf, where the past history of asthma is there, with the
Mm.
patient having asthma and rheumatism, which is aggravated in cloudy weather. So we need other symptoms also. Yes. So there are
Okay, sir.
many aspects of this patient, aspect to this case, which has to be get noted first.
Yes, totality of symptom, whole picture of the patient is required for the discussion of any case.
What I'm saying, that sometimes pathology plus pathological pathology is also characteristic.
Mm.
Sometimes the asthma and the rheumatism are concomitant.
Yes, sir.
Both are there. Asthma is also worse. The rheumatism also worse. Sometimes they alternate each other.
Okay, sir.
Sometimes they coexist associated with each other. The remedies are different. So you have to think like that. How's your asthma and rheumatism? Are they combined? Are they have common concomitant? Are they have common modality? Are they are common or this condition alternate? We have to go. We have to think like that. This is given specifically in Boericke, that this alternates at this stomach problem alternate with rheumatism, abrotenum mostly. Check hemorrhoids due to this condition. Chest symptoms, silica. Okay, so that's how you have to connect it कि भाई ये कैसे है. Otherwise you will give हाँ इसको अस्थमा rheumatoid natrum self दे दो. This is not going to work, and this is a sure shot formula for failure. Hello.
Yes, sir. So we have this direct questions regarding the pathological conditions, and
Hmm.
like we have Dr. Dipesh Solanki. He is asking any medicine in Boericke for temporal lobe epilepsy or temporal bone sclerosis in children created by high fever.
There are many remedies. Febrile convulsions, we have many remedies. It is Sina is one of the best remedies for febrile convulsion. It is written due to fever and worms also.
Yes.
And then we have Onianthe crocata. Onianthe crocata is a great remedy for convulsions if you are looking for that.
All right, everyone. So we have covered many questions, and now it's time for a surprise question answer session that we have some systems to discuss with Dr. Ranjan sir, and we are getting some remedies from the sir side. As per the system we have, like first of all, we have respiratory disorders. So there are some disease like allergic rhinitis, hay fever, sinusitis, asthma, and recurrent cough and cold. So, for these common disease, what remedies would you suggest, sir?
So we'll cover one or
Or
two that many areas like in where there are dusty areas, there is a common complaint of whether the pollution is more, like in Delhi or in other cases, there are the problem of allergic rhinitis arises. So many times, if the patient is suffering from only a dust allergy, patient said, I go in the dust, I, I, whenever the dust comes and I start sneezing and I start coughing, lycopersicum is one of the best remedies we have. Hay fever or hay fever allergy rhinitis aggravated by dust. Then the causations, if you look from the causations, then if the patient, then many times, uh, as we say, the hay fever is a diagnosis or the allergy rhinitis is a diagnosis. If the allergic symptoms is present in the patient, and the patient said that, sir, whenever I'm having this allergic rhinitis, I have I have I have to go for the urination. Uh, Many times I have this increased urge of urination. If you go through allium cepa, we many times overuse allium cepa in the allergic rhinitis. But if you want to prescribe it correctly, it is written in Boericke that increase urge of urination with the allergic symptoms. Okay.
Hmm.
If you have this, if the patient said that in allergic rhinitis that I whenever I get this symptom, I feel very hungry. You must have many patients that भूख बहुत लगती है कुछ ना कुछ खाने इधर छींकिया तो कुछ बहुत खाने का मन करता है. We have calcaria carb. It is written in calcaria carb. The patient has said that, sir, I have this. Whenever I get this episode of allergies, I have very my itching in ears. I have this also, but my ear itches more, more rather than my eyes and my nose. Cyclamen is the remedy.
Cyclamen.
My in the patient, in if you go through Vaithya, and if you retweet from the Kent and the Boericke, it will say that when the patient has this allergic condition, when the season changes, na, from winter to summer, then you have this pollen grains and you have dryness, you have sneezing in your watering of eyes. Vaithya is one of the best remedy. When you are getting a patient of allergic rhinitis, the patient said, sir, na, whenever I get this, I had this itching of this pilot. And
Yes, sir.
sir, yes, sir,
That,
and yes. So Arundo is the medicine.
okay.
Arundu, Arundu muriaticana is the medicine. It is very good remedy for this. And the patient said, sir, see, sir, my hairs are also falling. It is one
Hmm.
of the best compliment to the Arundo, that hair falling with the allergic rhinitis. But the patient should have this itching.
This is
Many times
that's right.
patients say, sir, I had na this uh, once what happened, my son has punched me in the nose. Sometimes small kids, they play and they don't know, they punched my kid, na. And after that, I started this uh, allergic rhinitis. If you see, if you combine the mechanical injury plus the catarrhal symptoms of the medicine, Euphrasia is one of the best remedies.
Euphrasia.
Mechanical injury. Many times patients say we ignore it. अपने को पता नहीं आर्नी का तो नहीं होगा sometimes. But we have many remedies for injury. We had injury in the nose and we started allergic rhinitis is one of the best medicine is Euphrasia. If you go the patient, sir, I have this itching of eyes. I am tired of this itching of eyes. Whenever I get this allergic rhinitis, the patient said that my eyes itch intolerably. I have this redness. I have put some drops, but still I'm not going to able it. Ambrosia is one of the best remedy. Yeah. So you can distinguish with the concomitant, with the causations. So you know, so that's how you have to combine. So diagnosis remain the same, but the medicine changes with the effects, the cause, and the concomitants. And that's everything is mentioned in the.
Boric.
Okay, this is
Okay.
not from any other, and that I'm getting so many patients because this is also a dusty area, and we give many we have many. And that's how we use the medicine. Sometimes they cured. Sometimes we need one or two in patient that the deeper acting remedies that anti-miasmatic, and this will also follow with the remedy. It's like in Arundo, there is also written heat of palms and soles. If you get a sulfur-like patient with this complete Arundo, after Arundo, prescribe sulfur.
Okay, sir.
The patient will be better.
Yeah.
That's how it is. It has been given. For asthma, we have to be very much with the depth and with the uh, precision. If you see in the natrum cell is a constitutional drug for psychotic asthma. It is written in natrum self. If you go to that patient has this greenish discharge. What is constitutional asthma symptoms? If you go through it, the patient have greenish discharge. The condition aggravated in the cloudy weather, in the damp weather. Patient has this rattling of mucus. If the patient get these symptoms, this is a peculiar condition of natrum self. So we can give the natrum self to that patient. It is psychotic asthma in children. It is written in Medorhinum. Psychotic asthma of children. Constitutional medicine for psychotic asthma in children. It is Medorhinum. It is also written in Boericke. Now, if you had a patient of asthma who has patient uh, lying what on what side, if your patient is uh, lying on better by lying on right side is antimetard. If the patient is better lying on left side, it's sternum mid. If the patient has this hollowness of chest, is weakness with this salty or sweet sputum, it is sternum mid. So that's how we can differentiate the remedies for asthma.
Yes, sir.
Okay.
And in the respiratory disorder, expectoration is very important to differentiate. Like we have so many different remedies with the even the change of the color of expectoration. We have different remedies for that.
Yes. Just like it is, if we have this uh, greenish discharge, we have Kali Sulp and pulsatilla. If we have white discharge, we have Kali Moor. If we have yellow discharge, we have Heparsal. If we have stringy and thick discharge, we have Kali Bai. If you have fluid discharge, we have arsenic. So there are many symptoms. If you have stuffy discharge, dry coryza, we have Sticta pulmonalis. Sir, I have to my children is nothing comes out. Is
Hmm.
only suffers dry coryza, Sticta pulmonalis. Simple. No need to go
Yes.
in the detail. What's बाप का क्या था, दादा का क्या था, मामा का क्या था. Nothing.
So
Patient comes there. Yes.
these are clear for these expectations.
If you are managing patient, a lot of patient in daily basis, you're not in the leisure to give a half an hour to this small complaint. You have to be on the right point. है इसमें है करके क्या? You take
Ah,
this medicine and go there.
yes,
Okay,
sir.
like in Sambucus, patient said that my has this my patient cannot breathe and doctor he cannot breathe. His nose is blocked and he has this cough, rattling cough. So blocked nose plus rattling cough like antimtard, blocked nose like ammon. It is a combination Sambucus nigra.
Ambiguous.
Sambucus nigra. You can see that. And my daughter, although my children wakes up with frightened. After that, he has started. He cannot breathe and he is very frightful. You can see OPM plus anti-mTAR. If you get this type of picture, Sambucus nigra.
All right, sir. So I would
So
suggest
that
please to get the pen and paper ready because sir is giving wonderful, suggestions and guidelines for your cases and the disease. So, sir, if you have time, already it's very late.
no,
So
we
it's
can okay. We can do one system more.
all right, sir. All right. So next we have sir skin disease. Like we
Okay.
have group of disease like eczema, acne, urticaria, and fungal infection. These diseases are very common in the in even today's
Choose
days.
one. Just choose one.
Just choose one. Okay, sir. Let's ask the people. Anyone? Is there any suggestion? What you want to choose from eczema, acne, urticaria, and fungal infection? Sir, I would suggest acne or urticaria. These two are very common.
Okay, acne. If you have acne, na.
Yes,
So
sir.
yeah, we have acne. We have variety of uh, patients. The acne which are cystic, which are pustular, which are uh, recurring, which are with large abscess. We have the remedy silica. Plus, we have the remedy calcarea picrata. If it is in mostly in boys with healthy people, we have
Mm.
this people, these pimples, na big obese girls who are suffering from these pimples, which are very painful, and the silica is not indicated. If it is silica, you can go for silica. Otherwise, it is calcarea picrata. If the patients are telling that these are my pimples, and if you touch it, no pain,
Mm.
nothing is there, but there are most so many big pimples, and then we can give calibro
Ah,
anesthesia. Anesthesia of the kings, which is calibro. Sometimes the patient said, "Oh no, doctor said, don't touch it," and even you didn't touch that pimples. You you had touched in the vicinity. So the induration is more uh, in the pimples in the side by areas, and and the patient is suffering from pimples which are big and cystic. So Eugenia jambosa is a very good remedy. Eugenia
all
jambosa is a very good remedy where the tenderness is around the part. Okay. So if the
oh,
patients are suffering from many patients said, na, कि if you have patient that, sir, uh, I didn't have that pimples in my young age in puberty, but now I'm 23, 25. I don't know how I'm getting these pimples in this age. So if you go through Ars Bromatum, as bromide, it is written in italic that acne in young people, not in puberty,
yeah.
not in the young people, those who are young for having that acne. Okay, so they didn't suffer from, mostly they are from puberty, but now that year has passed, they are matured and not
Huh.
that middle aged 20, 25 in 20s. Now they are getting the pimples. Arsbrom is the medicine.
Okay. Okay.
Okay.
Thank you, sir.
You can go through that. Then before menses, the mens the acne worse before menses, we have graphitis, sepia, uh, and one of the best medicine, if nothing worse, is folliculinum. If you go through the folliculinum, it is written that acne worse before menses. Okay,
Mm.
so these are some suggestions from me for the patients of acne. Uh, Plus, if you go through urticaria is very tedious disease. Many times, many patients told me that we are suffering from 10 years and 20 years and 30 years. We are daily taking any histaminic medicine. So there are many medicines. First, I had a case of a patient that, sir, see, I have this urticaria. Okay, what complaint do you have? Well, nothing, sir. These patches comes for my body. Those, like, do you have anything? No, sir. No itching. Urticaria without itching. Just like we have eczema without itching.
Oh,
Urticaria without itching. Uva urus is the medicine. I had one case in my mind. I had patient uva urus, and here it has gotten better. Then we have urticaria which is getting aggravated after meat. Whenever I drink meat, we have anti-crude or gastric disturbances. Then we have urticaria which is aggravated by alcohol. We have chlorellum hydratum. Whenever I drink, I get these urticarious eruptions. There is one big remedy which we call as pressure urticaria. Okay. Bovista is one of the best medicine for pressure urticaria. Next, if we see that urticaria with uh, gastric symptoms, if you say that doctor, I have this acidity, I have these gases, and I also suffering from eczema. The medicine is trifolium pratense, if I'm not wrong, or triosteum. Maybe trifolium, maybe triosteum is the medicine. Second, if the patient said that I'd had this eczema, and since uh, this eczema, I'm suffering from constipation also. The medicine is Copaiba. If you get through Copaiba, Copaiba, if the patient has urticaria with constipation, if the both symptom matches, then you can give Copaiba. So these are some suggestions for urticaria.
Oh, thank you so much, sir. Sir, I have a doubt from my side. Like Iconium maculatum, we see that in the menses with rash of small red pimples over body which ceases with flow. In bracket, it
Hmm.
is written Dulcamara. It is written in Allen's keynote. So, sir, I want to, I want to know that is this in this line? Are they indicating the pimples before menses?
Yes, sometimes they were saying that some type of
Say,
premenstrual
yes, sir.
symptoms.
Hmm.
Okay, sometimes there are some skin symptoms are associated with the premenstrual symptoms. So they generalize it as rash.
Rash.
That it may be a pimples, it may be
Hmm.
some type of itching, it may be some we can say congestion of some part because of the menstrual symptoms. It all has summarized into one symptom called rash.
Okay, okay.
It sometimes the rash is also many people say that I have this itching of breast na before menses and they become hard. Conium is the medicine.
Okay, all right, all right. So, and
Many times.
okay, so and sir, many times we see in the clinical practice of many homeopaths that many homeopaths prescribe Berberis equifolium for the ointment or for the local applications. So, sir, what was your experience regarding this remedy in acne?
Berberis aquifolium, if we go through its symptomology, it is very useful in psoriasis. It is useful in dark spots and
Wait,
other symptoms. So if we give it on indication internally, it is very good.
internally, yes,
For
sir.
the external application, it is no use
Yes, sir.
because
I
the acne is not an external disease; it is an internal dyscrasia. Okay. If you go to a dermatologist,
hmm,
he never simply gives you some ointment or soap. He also prescribe you doxycycline.
yes, yes, yes.
So he knows that this is the internal dyscrasia. This is a type of infection. It has to be treated internally also. And for the cosmetic use, patient has to feel better. So
Yes, sir.
I have to
Many
give.
for the psychological reason, we have to prescribe ointments. Like patient don't feel satisfied just with the medicine. Like if they have acne, they have to apply something.
Yeah, I told them if you want to be, I have one very simple sentence to say to my patients that you are suffering from acne.
Yeah,
Yes, yes. That's why you're using that much products. Does
yeah.
it help? Does it helping you or it is becoming the problem getting more or worse? He's saying I'm applying is 10 years. Still the patient, still I'm having the same complaint. One goes another. This is not
uh,
helping you. So leave it the
exactly.
patient. You are having acne because your skin is sensitive, and if you put more chemicals and more products in your skin, the skin become more and more sensitive. It will respond accordingly, and you will get this cycle of these changes. That sometimes this will happening, that sometimes the skin is getting dry, sometimes the skin is burning. You stop this, your skin is sensitive. If a
Yeah,
patient is sensitive to something, you don't have. If you are allergic to something, will you eat it? Bole say no. Then why are you applying on your face? The same goes to your face.
exactly, sir. And we need to understand that our skin needs to breathe.
Yeah.
This is also required oxygen. If we are putting so much ointments and creams and serums and lot of things we are putting on the face, the skin cells are not able to breathe. They are not
Yeah.
getting oxygen.
I told them to wash their face 4 to 5 times of with only water. Have 2 types of napkins, one for one day, another for next day. After using that one, put that in some disinfectant and wash it thoroughly and dry it, because it has so much infection. If you use one napkin recurrently, it will only transfer the germs from here to the other. So
Yes,
I tell them and give the medicine. The medicine will give the benefit also.
yes, of
Otherwise,
course.
applying Burberry's vulgaris give you a temporary results. Okay.
Yes, it's the duty of the physician to make the patient aware about the hygiene and all the other managements along with the medicines.
Yes. But because we know only one medicine to apply on skin is Burberry's Aqua. And
Yes,
that much effective. That the effective medicine to apply on the skin is given by Burnett, which is more effective than 10 times more effective in acne.
yes,
Okay, so that I'm not going to tell you. They let the people find it that it is one of the best remedies in acne. If you are not getting any result, it happens sometimes we stuck and we are not getting any results, and the patient said that we are panic, sir, come nahi ho raha, give come something. So there are ways to tackle that also, and Dr. Burnett has no exception. But the remedy he used, not a Burberry, is not the Burberry Aqua. If you go through
uh,
his literature, you will find that it is one of the best remedies to use in using acne as an external application.
absolutely. Okay, okay, okay. So
Okay.
we see in the today's time, patients are really conscious about their skin and looks. That's why I have chosen acne.
No, no, no. You are very, very right. Because of this, the use of cosmetics has shooted up. And
Yes,
those
yes,
who are using it, those who are not using it, those who are using it, they don't know that they are allergic to this.
yes, yes.
They are putting it and then say, oh my, I had this. And for this, they are again putting some more chemicals. Okay.
Already,
So that is the case. Sometimes that's why it is the skin elements from bad effects of cosmetics. We have many times Bovista is coming so in so many patients that yes, we are using it in many patients. So Bovista, sulfur, they are very because the skin is sensitive. Your first defense is so weak, and if you are putting something more and more, it will give you some major dyscrasia one day, and you will find out ये कैसे हो गया मेरे को, मैं तो इतना ही करता था. You are putting many things on your face, you are suppressing it like anything. So
yes,
you have to educate your patients, and you have to be have let them faith in you. And yes, sometimes you I'm not judgmental. See, I'm a clinician, I'm a practitioner. I'm not some uh, of speaker, or that no, this is has to be happen. Those who are not have 10 patients in their opinion, they will say that this has to be done like that. So, no, I see, and I go through many times. I have went through this, and now after 10 years of my practice, I am reluctant to it because I reached to that level, and the
yes,
patient will what can I say? They will honor my word that don't have to put it. They will with it because they see the patient. They will see that I am 10 years old. My hairs are gray. If when I was younger, 10 years before, patient not going to tell you used to say they have faith in me. The young doctor वो तो कुछ भी लगाने को भी नहीं देता है, क्या समझता है उसको. These are the medicine. I had gone to this. I
yes,
had gone to that. That's yeah, yeah. So I don't have any bad judgments for those who give some applications, because sometimes it is the if you think it practically, sometimes the patients are coming to you, they are much more older than you, they will not going to listen from you when you have this type of maturity, or sometimes then they will listen to you. So if it is sometimes it is not, it is necessary, you can give, but it is only a matter of time that you will see that this will not help you more with the case, and you have to you have to either you have to treat it with the right remedy, or you have to tell them that this much I can do, or patient will leave you.
Yes, sir. So, sir, we have covered lot of systems, and we have covered lot of questions, and the session was very informative. And also, I would like to thank audience also for keep their patience. And I think it's time to wrap up.
Yeah.
So,
Thank you so much.
available on the YouTube channel on Homeopathy 360. And if you visit the Homeopathy 360, you can see the other opportunities for the education, for the practitioners, and also this for the students. We have articles, blogs, case studies. You can publish your articles, and we have other things for also. Now it's time to wrap up. Thank you so much, sir, for giving us your time, and for
Thank you so much for the opportunity.
clinical experience. It was very helpful, and sir has given lot of energy to this session. He has made this session so it was so interactive, and it was really very informative, sir.
Thank you so much for the opportunity. I'm really honored to be on this platform, and I want to really praise the initiative is given by Homeopathy 360 to bring such a nice, wonderful peoples to the one platform, so that the younger generation can have the benefit of their knowledge and their experience. So thank you so much for opportunity.
Thank you, sir. Thank you so much. Good night, everyone. Bye bye.